Hello everyone. In this video, we will discuss on cold application. Myself Anusha Anand, working as a tutor in M College of Nursing. Objectives. At the end of this session, we will be able to define cold application, its purposes, classification, physiological effects, principles, contraindications, complications, and general instructions. Cold application is more effective than heat for sprains or other soft tissue injuries and is the preferred treatment within the first 48 hours after injury. Cold is applied to prevent swelling. However, cold application usually will not produce edema that is already present. Definition. Cold application means the application of an agent cooler than the skin. Cold application is also either moist or dry. Purposes of cold application. Cold relieves pain, prevents gangrene, to prevent inflammation, to prevent edema, to arrest bleeding, to decrease the elevated body temperature, to anesthetize an area, to decrease metabolic rate of the body, to provide comfort. Classification. Classification of cold application is divided into local cold application and general cold application. Local cold application is again divided into dry cold and moist cold, and general cold application is also divided into moist cold and dry cold. Local application in dry cold is ice bag, ice collar, ice pack, chemical, cold pack, and ice cradle. In moist cold, applications are ice to suck, cold compress, and evaporating lotion. In general cold application, moist cold, cold sponging, cold bath, cold pack, and dry cold, hypothermia. Physiological effects. The physiological effects of cold are generally the opposite of warm effects. Cold application has primary effects and secondary effects. Primary effects. In primary effects, vasoconstriction takes place. When we apply the cold application, blood flow to the injured area decreases, edema formation is prevented, and inflammation reduces. Local anesthesia. It reduces the localized pain. Slowdown in cell metabolism. Cold application decreases the oxygen requirement of the tissues. Increases of blood viscosity. Increases blood coagulation in injured area. Decreases the blood span. Reduces the pain. Secondary effects. The primary effect of cold application may last only for 30 minutes to 1 hour. After this time, a recovery time of 1 hour must be allowed, or secondary effects, that is vasodilation, will take place. Now let's see the principles. Cold causes constriction of blood vessels and decreases the blood supply to the area. Cold decreases metabolism and the cell activity or growth. The end organ of the sensory nerve in the skin convey the sensation of cold. The sensations are interpreted in the brain. Woolen materials absorb moisture slowly but hold moisture longer and cools off less quickly than the cotton materials. Moisture left on the skin causes rapid cooling due to evaporation of the moisture. Prolonged exposure to moisture increases the skin's susceptibility to maceration and skin breakdown. Contraindications. There are various contraindications for cold application. Cold should not be applied on patients who are in a state of shock and collapse. Cold should not be applied when there is edema. Cold should not be applied when there is muscle spasm. Cold should not be applied in disease or disorders associated with impaired circulation. Cold should not be applied when there is decreased sensation. It should not be applied when there is infected wounds. It should not be applied when the patient is having shivering or having a very low temperature. Complications. Complications of cold application: it causes pain, blisters and skin breakdown, maceration, grey bluish discoloration, thrombus formation, and hypothermia. General instructions. In hyperparexia, the temperature of the body should be brought gradually and steadily. Sudden cooling is dangerous to the patient. Protect the patient from getting chills. A shivering can rise the temperature. It also allows a patient to catch a cold. After the procedure, dry the part gently by patting on, not by rubbing, by removing the moisture, thereby prevent maceration of the skin and further cooling by evaporation. Maintain the correct temperature for the entire duration of the application. Never ignore the complaint of a patient, however small they appear to be. Hope this video is beneficial for you. Thank you.